Hello everyone, and thank you so much for joining us on our Health Matters program, where we discuss health matters, of course, because your health matters. I am a host, Troy Gill, and today we are going to be speaking about cervical cancer, who is most at risk, prevention, diagnosis, and treatment. And we have a very special guest with us here this morning. It's not the first time that he's on the program. He is the former Chief Medical Officer, medical practitioner, and also he is a public health specialist, and that is no other person than Dr. Francis Martin, and I believe it's going to make for a very interesting conversation, so stay tuned, don't go anywhere, we'll be right back. Hello everyone, and welcome back to our Health Matters program, where we discuss health matters, of course, because your health matters. I am your host, Troy Gill, and today we're going to get down into the conversation around cervical cancer, who is most at risk, prevention, diagnosis, and treatment. And of course, we have in studio with us this morning Dr. Francis Martin. He is the former Chief Medical Officer, medical practitioner, and a public health specialist, and we are going to delve deeper into what cervical cancer is all about. Dr. Martin, thank you so much for joining us.
Thank you for having me. It's usually a pleasure.
It always is. All right, and so we want to get into the conversation this morning, and of course we are going to be discussing cervical cancer. This is a month where we have cervical cancer awareness. And based on my understanding, the theme for this year, for this month, 2024, is Learn, Prevent, Screen. Learn, Prevent, Screen. And so I want to give you an opportunity just to kind of weigh in briefly on what you would think about the theme for this year.
That theme makes sense. Learn, Prevent, Screen, because especially for developing nations, middle-income countries, the kind of health systems that we have, the focus has to be on learn, prevent. Screening is huge as well. The more you screen, the more chances you have to capture something early. So especially for our countries, I'm really happy with that approach, because it is actually the public health approach that you use. And it all falls under the bigger theme of primary healthcare, which means you learn about the issue at hand, and you specifically learn ways to prevent the issue that's happening. And then, of course, the primary prevention is actually screening early, so that you can actually catch the disease in a very early stage, so that you can deal with it. So I think it's a very appropriate topic, and I look forward to hearing more of it.
Okay, and in the same vein, just kind of share with us a little bit as to, for persons who don't know, what is cervical cancer?
Well, cancer on a whole is a very broad term, and for that reason, there are many different types of cancers. Cancer is a broad term that simply means a cell is multiplying out of control. So anything that is out of control is a cancer. So if your skin cells are dividing and multiplying out of control, that's a skin cancer. You could also say if you have a teenage child that is out of control, you could call, I'd want to say So anything that's going out of control is a cancer. And it happens because the natural cells in humans, they live a certain lifespan and they die off. And then new cells grow up again, live a lifespan and they die off. But in a cancer cell, they're growing, they're living a lifespan, but they're not dying off. So after a while, more and more cells start going out of control. So cervical cancer is a case where the cells of the cervix are growing, multiplying, living a lifetime, and they seem not to be dying off. And that's really what cervical cancer is.
Also, can you explain to us, in terms of the human anatomy, about the cervix?
Well, the cervix is the opening of the uterus. Everybody knows, well, most people knows where a vagina is located. As you go into the vagina and you get way deep into the vagina, there is called the vaginal vault. Just above the vagina, the cervix opens right there. So the cervix is almost, well, not, for ease of explanation, it's almost at right angles to where the vaginal vault is. So when sperm is delivered into the vaginal vault, the cervix is right over there to absorb the sperm. So that's really where it is. And it's the opening of the uterus, which everybody is aware of where it's located.
All right. So share with us briefly, who is considered to be most at risk of cervical cancer, and what are some of the key risk factors for developing cervical cancer?
Well, I believe the people most at risk of developing cervical cancer are teenagers. Teenagers. And there's a reason why I'm saying teenagers, because teenagers who engage in sexual activity without understanding the complications and what can happen out of having sex too early may not be mindful of the risk they're putting themselves under. And so women generally get a very strong sense of health and well-being in the early 20s. By that time, you're already sexually active. So to my mind, those age groups are the ones that are most at risk, because they're the ones that most likely will have unprotected sex. They're the ones that most likely will have non-judicial, sexual behaviors. And unfortunately, that's the point at which they transmit the HPV virus, which is a virus that causes cervical cancer. I mean, the health system that we have and the health system that we've inherited, the guidelines are that women should have their first pap smear at 21. So it's only after pap smear you'll be able to test your risk of cervical cancer. And that time, the risk period has already far gone if you become sexually active before the age of 21. So I think this is really what the most risk persons are in that age group.
So promiscuous behavior can contribute to...
Oh yes, promiscuous behavior can contribute to HPV, and not just HPV, but chlamydia and gonorrhea, which have other reproductive issues, fertility issues, as Many years ago, the very first time I heard a gynecologist say that, and she was saying that unless we use that term, we will not be able to curb HPV or cervical cancer. She says cervical cancer is a sexually transmitted disease. At that time, people never thought about it that way. But she kept saying it's a sexually transmitted disease because HPV is sexually transmitted. And the data widely suggest for most countries around the world that HPV is the causative agent of most of the cervical cancers that we know.
And just for our viewers, we're talking about the human papilloma virus. And can you share with us a little bit as to what exactly is that?
Well, it's a virus, and viruses are basically protein particles that has a tendency to intertwine themselves into the DNA of human cells. And once they intertwine themselves into the DNA, they can actually cause damage to the DNA, and that really leads to damages of the cells, and that's why the cells grow out of control and so on. So it's a virus particle, and there are many strains of HPV. I don't know the exact number, but it would not be surprising to me if between 40 and 60 different strains of HPV across the world. But for our part of the world, it's only 4 strains that are mostly important for our part of the world. I'm talking about the Eastern Caribbean and for a large extent the OECS. And that's the strains 6 and 11 and 16 and 18, all right? 6 and 11 are the ones that are mostly responsible for genital warts.
Okay.
And then 16 and 18 is the one mostly responsible for cervical cancers. The one that cause genital warts do not cause cervical cancer, and likewise, those that cause cervical cancer do not cause genital warts. So in a light moment, I usually say to guys who have the genital warts, that say, at least you won't get cervical cancer. Or at least you won't get cancer of the penis, because we have seen cancer of the penis here. I have had patients with cancer of the penis because of HPV infection. So basically, that's really what that virus is.
So in that same vein, so what can persons do as it relates to sexual practices to prevent the onset and the likelihood of the development of cervical cancer?
Well, safest sexual practice is abstinence. You're going to laugh at me as well if I say abstain from sex, because nobody abstains. But abstinence to the point where you fully understand the consequence of sexual activity and what can happen, because there's a whole plethora of things that can happen as a result of having sexual activity. So abstinence until you fully understand this. Secondly, wearing a condom, and wearing a condom properly, that is, can actually help to prevent that kind of things. Also, we have a lot of data that suggests that voluntary early circumcision of men can assist with preventing of cancer, because the foreskin of the penis, or the prepuce as we call it in medicine, underneath there, it has a tendency to store a lot of pathogens or bacteria or viruses, and in this case, HPV. So a circumcised male would have far less chance of storing that virus under there, and has far less chance of transmitting that virus to a female partner. And not just HPV, but HTLV and HIV and those things. That's why there are data to suggest that if you do this, you can decrease the HIV incidence as well. So that can actually help to prevent. But probably the biggest help to prevent is the biggest help that humans have seen in medicine from the beginning of time. And that is a vaccine. Vaccines have saved more people in this world from the beginning of time than any other medical intervention. I mean, we remember yellow fever. I mean, Grenada has a particular history with yellow fever, in the sense that a lot of Grenadians died in the Panama Canal when it was being built because of yellow fever. Now you don't hear of yellow fever again, and that's because of a vaccine that is now used for yellow fever. There was the era when there were a lot of mumps, and you know, mumps can cause infertility and can cause problems with the male genital organs. When was the last time you heard about someone getting mumps? Ages ago, and that's because of a vaccine. Liver cancer was a very, very common thing because of hepatitis virus. Now, because hepatitis vaccine is being introduced, we're getting much and much less amount of liver cancer. And so, over the last decade or so, or two, we have now developed a vaccine for HPV. And you could get vaccines for HPV that covers the cancer-causing ones, which are 16 and 18, or you can get the quadrivalent one, which covers the genital warts as well as the cervical cancer. And so the vaccine has the potential, again, to provide the best and most successful prevention against cervical cancer, because you know it's very difficult to curb human behavior. Sex is going to happen whether you say it or not. So to those people, the vaccine becomes a very useful prevention.
Okay. And I'm happy that you mentioned that you spoke about vaccination, because we know, especially around the COVID-19 pandemic, there has been a lot of stigma and you know, sensitivity surrounding vaccination, because of all the misinformation that was out there, and so forth. So can I share with us even more? Well, as you mentioned, the HPV vaccine is very important. So who can access the vaccine, and where can it be accessed as well?
Well, fortunately for us, over the last couple of years, our own Ministry of Health was successful in adding HPV vaccine to our national formulary. So the vaccines that babies normally get, the rubella, mumps, and tetanus, and hepatitis, and so on, we've been able to add the HPV vaccine to our national formularies. Children at a very vulnerable age, and it can be anywhere from 9 to about 13, you can actually get the vaccine. In fact, I am aware that the Ministry of Health has a program where they go into the schools at those vulnerable ages and offer the vaccines to children at those ages, both boys and girls. They offer it to them. From a public health standpoint and globally, anyone less than 26 years of age can actually access the vaccine. And it means that, you know, if you're 26, you won't get it from the government because it's not extended wide enough to cover adults, you know. But children can get it. But that doesn't mean you as an adult cannot get it. You can actually purchase the vaccine for yourself, and you can have a healthcare provider administer it to you.
Okay, all right. So let's talk a little bit about screening as well, because as we know, that kind of falls in line with the theme for this year. So how important is regular screenings for cervical cancer, and how early detection plays a crucial role?
Screening is central to healthcare provision, again, in developing countries and for health systems in developing countries, because I always keep saying that developing countries will never be able to catch up to managing or treating diseases. If developing countries tries to treat diseases, their health systems are going to crash, because treatment of diseases, you will never be able to catch up. I mean, look at offering dialysis. In some countries, it's very expensive to offer dialysis. It's better to prevent someone from going into kidney failure than to treat dialysis. Chronic kidney disease or any kind of disease whatsoever, heart disease, developing blockages in your heart. We will, at developing countries, will never be able to adequately treat the amount of blocked arteries that causes heart attacks. So the sensible thing to do is prevention. And so screening is central to these kinds of things. Now, there are different guidelines around the world, but generally the recommendation is that you start screening at 21. Although the way I see things are going now and the trend I see things are going, I would not be surprised if some health systems have decided to screen people earlier than 21, especially if you become sexually active in your early teens, and we know that does happen. So this is critical, and the main reason why it is so critical is because early detection leads to a cure.
Right.
And that's why, as developing countries, you need to do this. I want to put a plug in here as well. That's why doing your PSA is important. That's why doing your rectal examination is important, because if you catch prostate cancer early, there is a cure.
That one is for the men. And I think I qualify because I'm 40 years old. So
right.
I need to get it done. However, can you just kind of highlight for us what the screening process entails and where persons can get screened?
Right. Well, the screening process involves using a pap smear. And I have to stop using the word pap, because for some public health persons who are aware of Papalinikou, I think that's where the name came from.
Okay.
He was a guy who developed pap smears, but we now know that there is a horrendous and horrible history to this gentleman on what he has done to black people in the process of developing the pap smear. So I like to say cervical smear because from a black Grenadian standpoint, I don't want to use this word pap anymore. A cervical smear to be able to identify the cells. Basically, the healthcare provider will use a speculum, insert it into the vagina, and the cervix becomes immediately available to him or her. A scraping or a smear of the cervix will be taken and put on a plate, and of course some substance sprayed on it to make sure it's fixed there, and take that to the lab for testing. So this is really what it entails. Taking the smear itself is just a few seconds, but setting up for it, putting the speculum in is a bit more tedious. Sometimes, depending on the skill of the healthcare provider and the cooperativeness of the patient, it can be a bit uncomfortable for some people. But I encourage both patient and healthcare provider to try and relax as much as possible, because to my mind the uncomfortableness of it is what is more important. You're not supposed to feel pain. You may feel uncomfort, but you're not supposed to feel pain. So if there is pain, there is some adjustment that your health provider should make. But that's really what a pap smear entails. Then you take it to the lab is going to do the test, and in a couple weeks you get the results back.
Okay. And how often should that happen, screening?
Well, when I graduate medical school, the recommendation is that you start screening at 21 and you screen every year. And if you have 2 consecutive normal years, you can start to smear every 2 years.
Okay.
Fast forward 20 years, now I'm understanding that the guidelines have changed. It has changed to state that you now test every 2 years. And if you have 2 consecutive clean 2 years, you can now go to 3 years. No, that's the guidelines. But the public health part of me is very cautious of that approach. In the US, for example, the guidelines for prostate testing has also lengthened. And I remember many years ago having a chat with one of our surgeons here about this whole issue of lengthening the time of testing prostate. I mean, we know we're living in the developing countries. We know the resources that we have here. We know the risk that we have and the and the social and environmental determinants of health. Those social and environmental determinants of health haven't really changed that much. We're still living in a very strict, very poor societies. We still have behavioral changes that are causing risk to our health. We have environmental issue that is causing risk to our health. And so my fear is that by screening every 2 years, we may just be missing some.
Okay.
And missing some can spell danger. So I would rather be very cautious, and I would rather that healthcare providers approach these things on a patient-by-patient basis, based on the risk that you know your patient is, based on the patient's behavior, patient's history. You may get away with 2 years of testing, but I strongly recommend that if there is any risk involved, you stick to the 1 year testing just to make sure you catch things very early.
Okay. So we're going to take a quick break. We're going to take a short break. Viewers, stay with us. We're going to be right back. Alright, thank you so much, viewers, for staying with us, and we are going to continue our conversation with Dr. Francis Martin on cervical cancer. And Dr. Martin, we want to talk a little bit about what are some of the symptoms of cervical cancer, how someone knows that they
Have cervical cancer.
have cervical cancer.
Well, I would answer this question the same way I answer all questions about all diseases when I'm given those questions. There are no symptoms.
Okay.
That's when you are diabetic, there are no symptoms. You only have symptoms when that thing is at that certain level where it's really out of control, and that's
Okay.
when you get sick.
Right. So that's when it's chronic.
Yeah, chronic, you could probably say chronic.
Okay.
Prostate cancer don't have any symptoms until the cancer has grown to such an extent that it's now blocking your urine and causing back pain. High blood pressure don't have any symptoms until it gets to the extent where it's going to give you a stroke or a heart attack. So, and I find that sometimes people ask what is the symptoms because they want to gauge themselves to see how close or how far they are from that thing. And that's a very dangerous approach. A very dangerous approach. Screening is what is important
because you want to self-diagnose.
Yeah,
Most cases.
most cases you want to self-diagnose. So the early cases of cervical cancer has absolutely no symptoms, and this is why screening helps you to be able to see the changes in the cells long before you get symptoms. But if, God forbid, the cancer has grown to the point where you're now having symptoms, the symptoms can be any of the numbers, any of the things that I'm going to say. Unusual vaginal bleeding, unusual vaginal bleeding, extended vaginal bleeding, dyspareunia, meaning that excess pain during sexual activity. Back pain is a huge part of it. You may have to start having weight loss or all kinds of things depending on how far the cancer has gone. And depending on where the cancer has moved to, you may have symptoms there as well. And cancers, as you know, can move to almost any part of the body. We call it metastasis. It can move to other parts of the body. If it goes into your bone, your liver, your lungs, your intestine, wherever it goes, you can have symptoms there as well. But most of the times, the symptoms that most women present with is severe pain in the pelvic region and unusual bleeding from the vagina. And God forbid, I hope no one uses that to go and say, let me get checked, because by that time things would have probably already been far gone.
Okay, so that's why prevention.
Oh yeah, that's why prevention is there, and that's why early screening is there.
Screening.
Yeah, because to wait until that time, usually people don't survive.
Okay.
You may get chemotherapy, radiotherapy.
Okay, I was just about to ask, what are the options?
Yeah. You may get radiotherapy or chemotherapy or surgery to a large extent. But the survival rate, and by the way, you know, chemotherapy and radiotherapy in the developed countries, they rate the success of these things by a 5-year survival or a 10-year survival. Which is interesting, because you're supposed to be trying to cure something, but you rate the success of it by keeping you alive for 5 years or keeping you alive for 10 years, which really means that survival is not the case, is not the aim, is to see how long you could stay on the therapy. So eventually you die. And this is why I really don't want anyone to wait until they start having symptoms. Because by and large, whether you like it to hear it or not, the system of medicine in the world is not geared towards curing anything. It's geared towards keeping you alive and for as long as you can. And people need to understand this.
Right.
You know, people behave as though medicine is there to prevent you from getting sick and so on. And yes, a lot of doctors would want that to happen. But the way the world is set up, it is not set up like that. You know, it is set up to be able to just treat whatever disease you have. No one is interested in curing anything. You're the only one that has to be interested in curing your own self, because nobody's interested in that. The pharmaceutical companies is not interested in curing anything. In the last 10 years, the most expanding business in St. George's is pharmacies. You have more pharmacies now than grocery stores in town. That should tell you something. If that is not speaking to people, then what else is going to speak to people? You know what I mean? So those are the options that you have. There are other things that can be done as far as curing is concerned. There is the loop procedure, where they literally cut out, or the cone procedure, where they actually cut out part of the cancer, or not part of the cancer, they cut out the exact cancer from the cervix and you're fine. Recently we have another modality, which is freezing the cells. As a matter of fact, now there's a process of doing a pap smear where the physician who is doing the pap smear can apply a chemical to the cervix, and in so doing you could actually see places on the cervix that changes have begun to happen, and right there and then the doctor can freeze it off and take it off, and that helps to prevent you from cancer. There's a lot of modalities that can be used to help ladies with that kind of thing.
Okay, so there is a possibility of life after having been diagnosed with.
Oh yeah, there is a possibility of life. In fact, when I was a health administrator, I had the opportunity of looking at the data. And I'm really happy to say that even if more cancers are being diagnosed simply because more screening is being done, the survival rate is much higher. People are not dying from cervical cancer as they used to be in the last 20 to 40 years. So there is a light at the end of the tunnel, and that is simply because First of all, ladies are more proactive in terms of their health. They
Right.
get checked when they're supposed to get checked, and the education is out there a lot more. And people know a lot more now than we've known before. And so I'm really happy to see that things have been improving.
And we're going to get into the education part of it. And so I want to ask this question. How can communities and healthcare systems work together to build awareness about cervical cancer, ensuring persons take more preventative action, screening and otherwise?
Well, communities and healthcare systems must work together. It cannot happen anywhere else. I used to use the term all of society approach. There must be an all of society approach to deal with any health matter whatsoever, not just cervical cancers. Ministries of health in our part of the world, and certainly in our Commonwealth, their job is not to provide health care. Ministries of health, their job is administrative. Their job is to make sure that guidelines are being followed. Their job is to do research, to answer questions about healthcare in our society. Their job is to provide facilities and provide resources for healthcare. Ministries of health are not able to manage healthcare. That's why I'm totally convinced that managing healthcare has to be done separate from a Ministry of Health. Otherwise our hospitals have to be on a separate body. There is no way we can do it as in a present construct. And in so doing, all of society approach has to happen. So the community involvement has to be there, because every successful health intervention that has happened in the world so far, every one of them, it involved the community. Interestingly, it also involved nurses. So nurses has a central role to play in understanding this thing. There's one called the Barefoot Doctors, which is a very successful healthcare story around the world. Community has to be involved, and it's all of community. And for all of community to involve, there are some things that we have to change. So for example, churches need to stop saying that their parishioners are not having sex. Yeah. Churches need to stop.
That's an interesting one.
Yeah, because by saying we don't have sex before marriage, if you say this, then your females are not going to feel that they want to get tested, right? We did a study here so many years ago when we were looking at risk factors for the LGBT populations, and we found that about 60% of the persons who were in that community were actually church-going people.
Wow.
So we need to say in the communities that yes, sex is happening in church. So because of that, you open the door and allow females.
So they need to accept that fact.
They need to accept the
that
fact
people are being promiscuous.
Right. Because if you don't, they won't get scared. They're screened, right?
Right.
So churches need to get involved. Then organizations within the communities, if they're sporting organizations or welfare organizations or community service organizations, they themselves need to educate and garner the support of their constituents to get tested. Organizations, I've held the public health opinion, that I believe organizations have a big role. Organizations can incentivize screening. So for example, a big company, let's say GrenCHAP for example, can say, if you get your pap smear and you get your regular check and you're clean, then you get this, and this. You incentivize them from doing their checks and so on. Banks, schools, they can do something to help people to feel like, okay, there is some benefit to me doing the screening. And I think that's an example of how a community can work with the Ministry of Health to engender the screening and that kind of thing. There are a lot more examples, but this is just an example of what I think could happen.
And I'm happy that you mentioned the LGBTQ plus and so on, because aside from those, we also have people who are often marginalized and so on. So why is it important for there to be inclusiveness?
Absolutely.
For these different groups?
Yes, yeah, there must be inclusiveness. As healthcare providers, we are healthcare providers first. Well, most. You should be a healthcare provider first. Your belief, your opinion, your feelings has nothing to do with provision of care.
Your preferences.
Your preferences has nothing to
Right.
do with provision of care. And it's only when you do that, you'll be able to do your job the best way that you can. All right? And it's important because if you don't do this, there are some things you're going to miss. So, for example, we do swabs to identify bacteria, to identify pathogens in the cervix if a lady has a vaginal discharge that is hurting her. And that's what it is. We can see if there's evidence of cancers as well. But if you do not accept the fact that people have anal sex, you will never swab the anus because you believe that this is not happening. And to your mind, that shouldn't be happening. So as a healthcare provider, you don't want to swab the anus. You cannot do this. You have to accept there are anogenital warts. That means HPV, which causes cervical cancer, is happening in the anus as well as the vagina. And so the healthcare provider, devoid of how he's thinking, what he's feeling, have to open himself enough to be able to do the screening in all areas of the human body.
Wow, interesting. Wow. We're going to talk a little bit about education. We touched on it a little bit. So why is education about cervical cancer crucial, and how can it help people to make informed decisions about their health?
I think education is what drives behavior. The more you know about something, it better informs what decisions you make. And unfortunately, many of us get educated too late about a lot of things. And so the earlier you start education is better. For ages now, there have been this debate in the health and educational sector regarding sex education in schools. There is one camp that says sex education for the age-appropriate sex education is the responsibility of parents and that kind of thing. And there's another camp that says age-appropriate sex education should be in school. I don't sit in any of those camps because I believe, as I said earlier, the all-of-society approach. I absolutely believe in the all-of-society approach for everything as far as public health is concerned. So I believe in the entity of age-appropriate sex education. And because I say age is appropriate, then there is no age. Is age appropriate? So you do depending on the stage of the child. So you can start at any age and be open to it. And again, I don't want to sound as though I'm bashing any sector, but again, the religious community has a huge responsibility there. Because there is a huge amount of denial in the religious community about sex and sex education. And whether you like it or not, a large portion of our community are religious. And so we're missing the opportunity of having that education really early in churches and other places as far as education is concerned. So that is critical because with education, of course, there are some people who are not going to take what you're saying, but that comes behavior. And with behavior, people are naturally going to adjust their lives and do things based on the risk factors that they're... I mean, look at what COVID has done. Prior to COVID, wearing a mask was not something that is heard of in this part of the world. In fact, we used to look at the people who wear masks overseas and wonder, what's wrong with these people? Now, COVID came, all of the education came about hand hygiene, respiratory hygiene, which, by the way, education that was already there long before.
Right. You
told people you have a cold, you have a flu, cover your mouth, cough in your elbow, don't go to work because you have a cold, you have a flu. Never bothered with us. But after COVID, you see that the people's behavior now is changing so much. So every day in my clinic, I see people coming in with masks. And I will say, are you having any respiratory system? What's going on? So this is how important education is. It is central, and again, I said all of society.
And I think parents need to accept that students are becoming even more exposed to information than ever before, and even certain practices. As a matter of fact, the Catholic bishop, he made reference to it on a recent program. He said that a lot of Catholic parents are struggling with the fact that their children are now they now have certain sexual preferences. You know, some are members of the LGBTQ plus, and the lesbianism is rampant in some of the schools and so on, and so they need to accept that fact. They can't run away from it. You know, and he was saying that some Catholic parents is like they had to even have interventions, in terms of counseling and so on with some parents, because to them it's like that is unheard of. That this just cannot be my child.
Yeah. I mean, boy, I'm a parent now, so
well, I'm not yet.
I remember when I was growing up, you always felt that you knew better than your parents, and the parents treated you in a certain way because you feel you know more than your parents. So it is not unusual in our society how we've been socialized from colonialism right up to now, that behavior is there. But the objective reality is, parents, yes, them children know more than you. So I stop argue. I don't take on my children that way now, because I know they're much more educated than you think they are. They're exposed to a lot more things than you think they are. And again, most of the education they get it outside. I mean, as a father, I remembered very vividly the time I had to have that sit down with my daughter, and I didn't even think about it. It was a friend who saw her in the streets, and a friend who I probably mentored as a girl, and she says, Dr. Martin, you remember that chat you used to have with me? You need to have it with your daughter now.
So you know what that means?
Of course I knew what it meant. And that was the most difficult conversation I've had to have with my daughter, but I had to have it.
Yeah.
And when I finished it, I felt like a man, because you have had that very raw, open discussion, and so the relationship has been saved because of that conversation. So yes, parents, we need to open up ourselves, and again, not be judgmental, and love your children and give them the opportunities so that they can fulfill the full character and the full potential, and just be there as a support for your children.
Yeah, because I like the way she coined it. So you got the message. And she came straight to you.
Yep.
She didn't go to Tom, Dick, and Harry, and Jane, and Lisa, and whatever, and and so on.
Yeah.
So that's interesting. And it got your attention.
I mean, it did. How could somebody that not get your attention? Yeah. So, and by the way, having that conversation with my boy was much, much easier, because I have a girl first and a boy after. So having that with her was traumatic to me. I almost think I had a glass of wine after that. But having that conversation with my boy was much easier because I had to have it with my daughter.
Right. So how do we, because we know lifestyle is also, so how do lifestyle factors contribute to the risk of cervical cancer? I'm sure you'd have mentioned some before.
Yeah.
And what lifestyle changes can individuals make to lower that risk?
Right. Now, lifestyle and cervical cancer is directly linked. And as I say, education impacts on lifestyle, which then impact on cervical cancers. The foods that you eat increases your risk of cancers. We are now aware that there are very risky agricultural practices on foods that are imported into the country. We are very much aware that there are commodities that are used in foods that are imported and meats that are imported that do not protect you from good health, and in some instances can cause cancers. Those two commodities that I speak most about are high fructose corn syrup and soy products. Those are genetically modified to produce, the soy that we get in our part of the world is genetically modified to produce more estrogen, because it is used to feed animals and so on. And so us consuming soy products increases estrogen production, and estrogen is one of the major causes of cervical cancers. That's lifestyle. We even have situations where a mother might be pregnant with a boy child and is using soy products during the pregnancy, exposing the unborn boy to lots of estrogen. And then the boy is born and he may be allergic to milk, and by the way, we don't need milk. Humans don't need milk.
Right.
Would feed the boy soy milk, and soy milk has a lot of estrogen in it, and that increases the chance of hormonal imbalances. Girls having periods very, very early because of extra estrogen. And some cases even precocious puberty, meaning that they get in puberty long before they're supposed to, like 6 years or 7 years or something like this. So that lifestyle that includes eating processed foods not only takes away your ability to fight the cancer, but in some instances can give you the cancer. The high fructose corn syrup and those things are known to decrease the amount of free radicals you have in your body, and free radicals are the things that knocks up the DNA and damages your DNA and causes cancer. So the lifestyle change that has to happen first and for all is adjusting what we eat, eating less processed foods, eating more local foods, because we're fully aware that the local foods are much better. And then of course the major lifestyle change is abstinence from sexual activity, or having sexual activity in a responsible way, to prevent your chances of getting HPV. And that lifestyle still is not only sexual activity, but the numbers of partners that you have can also increases your chance of getting HPV. So that lifestyle is, again, as education, is central and must be changed in order for that to happen.
All right. So even as we wrap up, we come to the end of the program. Just going to share with us a little bit again on the theme, Learn, Prevent, Screen, for persons who would have just tuned in, the importance of learning about cervical cancer, preventing and screening, because as you mentioned, it is highly detrimental.
Yeah,
it's a very chronic disease, and prevention is always best.
Absolutely. And as I've said before, never in our lifetime have we had so much medical information available to us. Never in our lifetime have we had so much healthcare providers who are able to come and speak to us and learn a lot about health. But even if we have so much education, the advent of the internet, information available to us, people are still dying more and more. Diseases are happening more and more. So we really need to ask ourselves, why is this happening? And as soon as I ask myself that question, the answer comes back to me. It is because you and I have moved away from how our foreparents taught us to live.
Right.
How they taught us to love, learn, and how they taught us to eat. And if you moved away from it, this is what we need to do to get back to that healthy safety. Just move back to how our foreparents taught us to eat, how they taught us to live, how they taught us to love one another. And lastly, we now know, and the data is clear, that for small island developing states and for developing countries, primary health care or primary prevention is the number one way, and it's the only way that you're going to get a good health situation in your country. And so the theme, Learn, Prevent, Screen, that theme speaks to the heart of that primary health care. Learn about your body, learn your risk factors, learn about HPV and cervical cancer, learn what to eat. That way you can prevent. And if, by God's grace, if God forbid you're not able to prevent, screen, get checked early, find out what's going on there early, because in almost all of the cases, as a matter of fact, in almost all diseases that we know, knowing early gives you the best chance of curing yourself. And that's not just for cervical cancer, it's for most chronic diseases that we know.
Right. Well, thank you so much, Dr. Martin, for taking the time out to share with us. Really appreciate it.
My pleasure.
All right, guys. So that was Dr. Francis Martin, former Chief Medical Officer, medical practitioner, and public health specialist, sharing with us just a little bit about cervical cancer. We are in the month, Cervical Cancer Awareness Month, January 2024, and the theme for this year is Learn, Prevent, Screen. Thank you so much for joining us on our Health Matters program, where we discuss health matters, of course, because your health matters.